I started working for Everlight in 2017 on the recommendation of a friend and colleague who'd been working for Everlight for some years. I've had a varied medical career, including more than a decade as an ED clinician before I started radiology training. And in 2017, I was working full-time as a unit head in accident and emergency radiology in a busy public teaching hospital. I was Chief Censor for the Royal Australian and New Zealand College of Radiologists, overseeing radiology training across Australia and New Zealand. I was travelling a lot, in Sydney every few weeks on college business. I was a perpetual student doing back-to-back master's degrees, and my children were at or heading towards university. I think there are various reasons why people choose to work at Everlight, and that their reasons may change over time. For me, I think I could see a time when my children would be independent and where I would have the flexibility to travel more broadly. And Everlight gave me the opportunity to do this while maintaining my ED and trauma radiology skills. I was finishing a master's in health administration, and I was also aware quite early on that there were potential opportunities from an administration and leadership perspective. I was hugely impressed by Everlight's commitment to quality improvement through its peer review program and in its commitment to education through the Everlearning platform, not only for its own radiologists, but also for trainees across the different jurisdictions, and in the provision of freely available educational resources for radiologists across the globe. When I started reporting for Everlight, I was very much a Flexi reporter, picking up 5 to 10 hours a week on the weekend, and I loved the work. The excitement and pace of ED reporting with a hugely varied case mix, coming from sites ranging from small rural and regional centres to metropolitan teaching hospitals. I was completely in my comfort zone, able to focus entirely on reporting with the support from an amazing team of operations staff. Our CEO, Rob Anderson, often speaks of the importance of the Everlight global community, and even at that time, I was starting to feel part of that community, meeting with other Everlight radiologists and staff at functions and conferences. I think the turning point for me was in 2024, when I decided to take a mid to late career gap year or sabbatical from my public job. I'd stepped back from my college roles, had gradually increased my reporting hours for Everlight, and had taken on the role of a clinical director in clinical governance and risk. And I was thinking about my career progression. I essentially abandoned my husband and children, I think with their blessing, and I moved to the UK for 4 months to report week on, week off from the London office, becoming a nomad and travelling around Europe in my off weeks, from Iceland to Denmark to Italy and France and Spain. After 25 years of mothering, this was pretty liberating and demonstrated to me that I could be completely fulfilled from a professional perspective by what Everlight offered. This year, my career has shifted again. I've been honoured to take on the role of the Australian and New Zealand and South Africa Medical Director for Everlight, and I've relinquished my long-term public hospital role after more than 20 years. This brings with it new challenges, but also new opportunities, and it allows me to utilise the skills I've developed over the course of my career and through my various university degrees. I think there are enormous challenges ahead in the provision of equitable healthcare globally, and that Everlight is well positioned with more than 800 radiologists across the globe and an amazingly talented operations team to ensure rapid incorporation of new technology and AI solutions into our workflow, which will allow us to address this challenge. We are committed to being at the forefront. We are acting in partnership with health providers across the world to create global standards in teleradiology care.